Hello everyone, my name is Shelley Blackwood and I am a student of Athabasca University working on my Master of Nursing. I am a registered nurse working on a surgical thoracic unit in St. John's, Newfoundland. Today I will be talking to you about blood pleurodesis as a treatment of ear leaks in postoperative lobectomy patients. This topic recently sparked my interest while I assisted a physician with this procedure. My question was, in adult postoperative lobectomy patients, is blood pleurodesis more effective than Heimlich valves in treating ear leaks? The research shows that it is safe and is more effective than Heimlich valves for treating ear leaks. It allows chest tubes to be removed within 12 to 72 hours of the procedure. Chest tubes that are in situ for prolonged periods of time put patients at risk for developing infections, empyema, DVT, and can lead to increased risk of cardiovascular events. As well, prolonged hospital stays are associated with large amounts of healthcare dollars. By having blood pleurodesis, chest tubes can be removed earlier and patients won't be at heightened risk for further illness. I notice that there is no policy to guide nurses when assisting physicians with this procedure. Therefore, my intervention was the development of a policy for blood pleurodesis. Prior to the implementation of the policy, the nurses will be educated on it by the change agents, which will be myself and the clinical educator. We will be present if any questions arise. Now we will demonstrate the implementation of the policy. Blood pleurodesis policy. The physician explains the procedure to the patient, including complications.
Okay, so first of all, we're going to turn off this system. I'm going to clamp your chest tube and take it off. Then our lovely nurse here, Crystalina, is going to draw some blood. Once she gets the blood, I'm going to put the blood back up through the chest tube and then re-hook it back up, okay? So if you feel like any shortness of breath or chest pain, you can just let us know, okay?
The digital chest drainage system is set to standby or turned off by the physician.
Okay.
The chest tube is clamped by the physician using a chest tube clamp and tubing disconnected from the patient.
Okay, so I'm just going to clamp this right here. Okay, I'm going to take this off.
Tubing is kept in a sterile package to maintain sterility.
And I'll just leave this up here for you, okay?
The registered nurse inserts an IV and withdraws 20 ml of blood from the patient's intravenous using the 20 ml Luer-Lach syringe and then passes it to the physician. The physician attaches the Luer-Lach syringe to the 60 ml cath tip syringe to transfer the blood into the cath tip syringe and then quickly attaches it to the chest tube.
I'm going to put this back up through here now, okay?
The physician unclamps the chest tube and inserts the blood into the chest tube. This procedure may be repeated for usage of 50 to 250 ml of blood as decided upon by the physician. The chest tube tubing is then reattached and clamp removed by the physician. The digital chest drainage system is then placed high above the patient's chest, preferably hung on an intravenous pole. This step is important as it allows airflow. Do not clamp the tubing as this may lead to a tension pneumothorax. The patient is encouraged to move from side to side in the bed for 2 hours or a period decided upon by the physician. This movement helps to coat the lining of the lung with blood. After this period has passed, the registered nurse puts the digital chest drainage system back to ground level and reapplies suction. A chest x-ray is taken by the physician at their discretion. If the procedure is successful, the ear leak should resolve within 12 to 72 hours.